I'm going to quickly review some parameters to interpret the CT perfusion studies. So here we have a brain, and these squares represent a given tissue. So here we have blood which is going to come in from a vessel, and it's going to fill up this volume of brain tissue to a certain extent. So we have the blood coming in, and that's coming in at a certain cerebral blood flow, and it's filling up the tissue to a certain cerebral blood volume. Now, it took a certain amount of time for me to draw in the blood flow coming in from the vessel and filling up that volume. And the time it took me to fill up that volume till it reaches its peak is the time to peak. And then eventually the blood is going to leave that volume of tissue through the veins. Now let's follow one blood cell as it travels through this pathway. So we have this blood cell that's coming into this given tissue, and the blood cell is hanging around in there for a certain amount of time until it finally exits. So the mean time that a blood vessel would spend floating around is the mean transit time. So let's say on this side, blood flows in, and this tissue is dead or dying. So it's not going to hold much blood because the tissue is not viable. So there's less blood that fills that tissue and less blood to exit. So this tissue would have a low cerebral blood volume, and that is analogous to DWI on MRI. It reflects that that tissue is not viable. So if blood flows in very slowly, so cerebral blood flow is reduced. So blood flow is reduced, and it doesn't fill up very much, so cerebral blood volume is very low, and it took a long time just to reach this point. So the time to peak was long, so the time to peak was high. Cerebral blood volume was low, cerebral blood flow was low, and the time it took for that little blood cell to kind of hang out before it left the veins was also very long. So the mean transit time was high. So because the cerebral blood volume was low, this is non-viable tissue, and it matches the other parameters. So cerebral blood flow, mean transit time, TTP, and CBV all match. So this would be non-viable. Now let's have the area of tissue fill, and it's going to fill slowly. So CBF is low, but even though cerebral blood flow is low, it's going to fill up to the normal volume. So here it took a long time to fill, but it did fill normally. So cerebral blood volume was normal. Cerebral blood flow, we said, was low. The time to peak took me a long time to get to that peak, so that was elevated. And if we follow that red blood cell through, we would see that that red blood cell hangs around for a long time as it makes its way through the tissue, being fed by collaterals to exit. Mean transit time is high. So tissue that matches these parameters are viable but have reduced flow. So this represents potentially salvageable tissue. Now we pay particular attention to the mean transit time or the time to peak because those are the more sensitive parameters for detecting ischemia. So cerebral blood flow might be normal, but if the TTP and MTT are abnormal, then that suggests ischemia and tissue that may be salvageable. Now what you might have is the situation where blood flow is coming in and it's filling slowly, but in one area, the blood volume becomes normal, while in another area, it stays low. So in this case, in the periphery, you have normal cerebral blood volume, decreased cerebral blood flow, and MTT and TTP, time to peak, are increased. Whereas in the center, you have low cerebral blood volume, low cerebral blood flow, and MTT and TTP are both elevated. And so this would be the core of the ischemic infarct, and the surrounding is the potentially viable tissue.
So this example was scanned on the Canon, and what you have over here is cerebral blood volume, TTP, which is what we use on the Canon. It's analogous to MTT on the Siemens system. This is MTT down here, and here is cerebral blood flow. So if you look at the TTP, you see that this area is markedly increased in time to peak. Okay, you see a little bit of MTT increase, but it's not as useful on the Canon. Cerebral blood flow itself is slightly decreased in that area, and cerebral blood volume is mostly symmetric, although there is an area where cerebral blood volume is decreased. So the conclusion in this case is that most of the area represents decreased cerebral blood flow, which is ischemia, and essentially it's a moderate-sized penumbra, as there is a small area of decreased cerebral blood volume. So here you have another example where you have on the TTP image, you have this very large area of increased TTP, corresponds to a large area of increased MTT. Cerebral blood flow is decreased in that area, and cerebral blood volume is mostly symmetric, except for a few areas where there is decreased cerebral blood volume, notably in the left putamen and around the caudate corona radiata. So this corresponds to an area of smaller infarct with a large penumbra in the distribution of the left MCA. So this is another example taken on the Canon. So we're going to forget about MTT, we're going to focus on TTP. So here we have an area where TTP, the time to peak, is increased, particularly in the posterior left parietal lobe. And here it corresponds to a matched defect in cerebral blood volume. Cerebral blood flow also matches this area. So this is an area of core infarct without significant penumbra. So I'm going to show you a CT perfusion template that you can use. So if you say insert CTP, this template comes up, and it has each of the maps listed that you should analyze. And then initially you can check from the pick list where it has a normal, a focal, a diffuse, or if there are multiple deficits. You can also dictate your own description at the next field. You can choose from any one of a number of vascular territories. So for example, you could choose MCA, or you could choose the PCA1 template. Then the next field gives you the option of adding which side is abnormal. Then you go to the cerebral blood flow, and you can do the same thing. And the verbiage on the pick list is the same. So if the cerebral blood volume matches cerebral blood flow, you can say focal. And then if you're using the Canon and you're not using mean transit time, you would select not. But if we're using the Siemens system, then we would. I can say focal. Then if we're using Siemens, we'll say we're not using time to peak. You can list any limitations if there are any. And then if it's a matched defect, you can just say match or mismatch. And you can also elaborate on any of the fields.